Okay, next question. What is extra help with prescription drug costs? Will I qualify? Is it the same as the subsidies? All right, let's start with that last one first. Is it the same as the subsidies? No, it is not. Subsidies, excuse me. Subsidies refer to the premium reduction for a person that is making below a certain income threshold for major medical under the Affordable Care Act if they purchase individual major medical from the healthcare.gov marketplace. That's what a subsidy is. Extra help is not that. Extra help is a reduction in premium, prescription drug costs, and the donut hole or coverage gap, depending on how you want to look at it, and deductible with prescription drug plans based on your income and asset level. They do take different things into account than they do with the subsidies. For one thing, basically, as long as you are eligible for Medicare, you are eligible for a Part D subsidy. Also opens up a few things as far as your flexibility goes for getting a prescription drug plan as well. Most people can only make one change a year during the October to December period for prescription drug plans. People receiving extra help have a open window where they can make one change a month if that's even necessary for them. But what I did, I went and pulled some information from Medicare Social Security. It's actually a little odd. Medicare and Social Security are actually two different departments, yet they kind of work together for Medicare. The extra help, even though it is to reduce costs on a Medicare program, is pretty much determined by Social Security. So I wanted to kind of read you. This is from February. Did they give a revision date on this? No. I pulled this on February 24th, 2017. This is what it says on Social Security's site for whether if you should even consider applying for extra help for prescription drug costs. Here's what it says. Your combined savings, investments, and real estate are not worth more than $27,600 if you are married and living with a spouse, or $13,820 if you are not currently married or not living with your spouse. Do not count your home, the one you live in, vehicles, personal possessions, life insurance, burial plots, irrevocable burial contracts, or back payments from Social Security or SSI. So basically, if you have an IRA or a 401k and you're married, and that IRA has more cash in it than $27,600, you are most likely not going to qualify for this help. There's also an income threshold with it, and they didn't print it out on this page, and I don't have the 2017 numbers with me. This number is also going to change a little bit going into 2018, but at the moment, if you're married filing jointly, the amount is $27,600. If you're single, it is $13,820. So if there's more money than that from investments and retirement plans in your name, then you're not going to qualify. Now, if you meet the criteria, there's also the income criteria as well, which, like I say, I don't have. And if you get that, then you qualify. And the amount that is reported to Social Security, the amount that they find out, is what they're going to use to determine the level of extra help you're going to get. So extra help isn't just you get it or you don't. There's also levels. Basically, you can get 25% of extra help, 50% of extra help, 75%, and then the full 100% extra help. Here, let me just tell you what the 100% is going to do. And these numbers aren't going to be exact either because I didn't pull them and they are not on the page and it's still a fairly new year. So I don't have them memorized yet. But what happens when you get extra help is that you're going to get a premium credit for a Part D plan. What a premium credit means is they won't necessarily pay 100% of the premium for Part D, but they'll pay a portion of it, like $30-something a month for the 2017 numbers. So if your prescription drug plan has a Part D premium of less than, say, I'm pulling this number out of my hat, $30 a month, then you wouldn't pay anything for the plan. Additionally, the extra help means if you get full extra help, they'll knock the deductible out. So your deductible this year can be as much as $400. If you have a $400 deductible and you get the extra help, you don't have a deductible. You switch to copays. Then the copay, it also eliminates the coverage gap, also known as the donut hole in some areas. If you qualify for this extra help, the donut hole is going to be eliminated, and instead you're going to wind up just paying a cost about $2 and some change. It's pretty close to $3 now for each generic drug you take, and I think it's up to $7 this year in 2017 and some change for each brand drug you take. No donut hole. Now this is a significant reduction from the cost that you would pay if you were getting just no extra help. So if you were just a person on the standard Medicare Part D plan, the costs are generally significantly larger than that. Plus there's the coverage gap, plus there's the deductible involved for some plans. But that all that all goes away on Medicare's extra help program if you're getting the full extra help. And if you get a graded extra help, in other words, you don't get full extra help, then you get a portion of it. Now, a person that gets extra help, that does not kind of solve every problem that they have. Let's see, the question is, will I qualify? So that's how you qualify, so we're just into what is it. So that is what extra help does, but the other thing with the extra help plan is that the extra help, there are still some considerations that you have. So by qualifying for the extra help prescription drug plan, or for extra help with prescription drugs on a prescription drug plan, there are still some considerations you have. The most important one is to get the drugs on extra help. The plan you're in must have the drug on the formulary. And what that means is that the plan needs to cover the drug. No plan covers every drug, and it is possible that a plan could cover a drug in year 1 but not cover that drug in year 2. So for our clients that qualify for extra help, they know that for our clients, period, they know that we're going to call them back each and every year in October to find out where they stand on their drug lists, and we're going to add new drugs that they may have or changes that they've had, and we're going to rerun that list on the plan that they've got and see if it is going to continue to cover them. If they're getting extra help, we don't have as much of a cost issue, although there are times where costs come up because some plans will cover a generic as a brand, and even on extra help you could be charged accordingly. But more importantly is that if that drug is no longer covered the next year, you could suddenly go from having to pay a $7 bill to a $400 bill, and the only thing that changed for you was the year. So those plans can in fact drop a drug. Now they're supposed to let you know, and to the credit of just about every prescription drug plan I've ever seen, whether I work with them or not, they do their best to try to let you know. Whether you notice it or not, that's a different story, especially that time of year, because you get so much mail, so many phone calls. It's easy for something legit to kind of get lost in the shuffle of all the soliciting that you get at that point. But a drug, it is perfectly legal for a plan to cover a drug in 1 year and then drop it the next. So that's why with our clients, we kind of knock ourselves out each and every year trying to get relook at a plan to see, is it necessary for you to change and get a new prescription drug plan, or can you stay in that plan? The extra help does not help with that. The only thing the extra help does is give you the best cost that really you can possibly get short of it going free. Extra help, be aware, is also one last thing about this. Extra help is not Medicaid. Medicaid is another level, and that is not a determination made for by Social Security. That is a determination made by the state that you live in. Now, if you apply for extra help and your income and asset levels are to a certain threshold, they may automatically, with your permission, forward your information to the state that you live in and help you apply for Medicaid because your income and assets are just that low. But if you qualify for Medicaid, the level of extra help you get is actually increased, and those costs will go even down further, and to a point where you would actually, it's this kind of sliding scale where you got the full cost of your prescription drug plans for people that don't qualify for any extra help. Then you got this graded scale for people that get the extra help, and it kind of stops here. The costs are really low, especially compared to that. I probably should have gone down to here. But then there's a point below that where if you really qualify for Medicaid within your state, then you'll get even lower costs still. So those are kind of the levels of extra help. Some people, if your only income is Social Security, and Social Security knows it, they will apply for the extra help for you. So a lot of people don't need to actually do anything. Same with Medicaid. If you're getting Medicaid before you're 65, and you continue to qualify for Medicaid when you turn 65, they're going to take care of your extra help needs for you. But if you're not sure, if you're one of those people that kind of falls in between those cracks and we're not really sure, you're not sure if you're going to qualify for extra help, ask me or ask my partner. When we sit down with you, we will be happy to take a look at that with you. We've got the income and asset thresholds for the year kind of written down, and you can kind of tell us a little bit of about what you got if you're comfortable doing that. We'll be happy to help you determine whether or not it's even worth your while to try to apply. For the most part, if you're close, we're going to tell you to apply. We're going to probably help you apply because it's pretty easy to apply. There's been more than a couple occasions where we have actually sat down with these computers and actually done the application for you. And, we've, of course, put down that, yes, we assisted you with the application. We identified ourselves. We identified who we are. And we will work with you to apply for that extra help, just because that's part of the service that we're going to do, because it's only going to help you. If you don't get it, you don't get it. There's no harm in you actually applying, but there's a great deal of benefit where if you're kind of like pretty close to that line, we're going to help you apply and let Social Security tell you what you can do to kind of be on that line, or if that line is fungible or anything for you, and let them kind of figure it out. But we're going to help with that. So that's kind of one of those things. What is extra help? It's something that really can be of help to you. There is really no harm in applying if you think that you may be within the criteria to apply for it.